Hello, Dr. Mancini. My name is Sierra. I am a level 2 MOMAC nursing student. Today we are going to be doing your dressing change. We can just verify that with the doctor's orders. And can you confirm your full name?
Jared Mancini,
Okay, and when is your date of birth?
December 19, 1997.
Okay, and we're going to compare that with our MAR. And both patient identifiers match up. Okay, Mr. Mancini, today we're going to be looking at your wound and redoing your wound dressing. Are you comfortable where you are?
Yep.
Do you have any pain?
Just a little bit by the wound.
By the wound? Okay. Can you describe that pain?
It feels localized. It's kind of dull. It's not too bad.
Okay. So we're going to take a look at that. We have our dressing changes here. So I'm just going to, you have your wound there, so I'm going to make sure you're comfortable, which you said you were. I'm going to wash my hands. Placing a garbage bag over here so that we can put the soil dressings in there. I'm going to put on gloves. And we can remove your soil dressing. Okay, so we're going to examine the dressing. So the color, there is a red coming off of it, so it's bloody. This is a sanguinous type of wound drainage because it's freshly bleeding and it's bright red. Also, you can see that on the wound. It's not serous because serous would be clear watery and it would be like plasma. Serosaginous is like a pale red, so it's more watery mixed with the blood. And then purulent is thick yellow-green or like brown drainage, which would be a sign of infection. So this is sanguinous, bright red bleeding. Okay. The wound looks like it's in the proliferative phase. There's no swelling or redness present around the wound. The edges are starting to come together and have started concentrating, which is contracting, which is the proliferative phase. And then maturation is where the patient will likely come to. It's the stage where there's a bunch of tissue formed and a bunch of tissue layers and collagen that would be pretty much the wound has been healed. So we can discard this into our garbage. And so now we're going to look at the wound a bit more. It looks to be an acute wound. That's a wound that has occurred suddenly, and it has a predictable time that can follow the wound healing process. A chronic would be, it doesn't have a order in which it will heal, so they don't seem to be detained in more than one, or they seem to be detained in more than one phases of wound healing. So it's also an open wound over a closed wound because an open wound is where it happens relatively quickly and the skin is cut or torn, which it looks like in this case. A closed wound is where it would be like a forced trauma causing a contusion of the blood, so it would be like a bruise. So yours is an open wound. She is also in the secondary stage of wound healing because the wound is left open and it's allowed to heal by scar formation. There was a little bit of tissue loss and like open wound edges, and the granulation tissue will gradually fill the area. This is at a greater risk for infection than primary wound healing. Primary wound healing is like a clean cut where the surgical incisions remain close together, and the wound will heal very quickly and there's no tissue loss, or it's very absent or minimal. And then tertiary wound healing, it's like a delayed primary intention or closure. So the wound's left open for a few days, and which allows edema or infection to be diminished, and then the wound edges are sutured or stapled together, which is not the case for this wound. Okay, so now that we have assessed your wound, we are going to put the new bandages on it. First, I am going to discard these gloves that we used to look at the wound in the infection site, so we're discarding those. I'm going to do hand hygiene. I'm going to open our wound kit. We're going to open it away from me, and I'm going to put it over here so I have room to make a sterile field. So we're opening our wound kit. I'm going to put on, no I'm not, I'm going to grab the edge of one of the tweezers. These are now non-sterile. And we are going to pull out our sterile field. You have a 1-inch border, so you are allowed to touch the edges. Just 1 inch. And you're going to want to put it in front of you and make sure that you have everything so that you are not contaminating the space around you. And I'm going to put this over to my side so that I'm not constantly reaching over. And then I'm going to move this. So now this isn't sterile anymore, only this part has been. So I'm going to put that on the edge. So before we put our sterile gloves on, we are going to open the packages. You're going to open them. They are sterile until they have been touched, so you're going to open them and put them on the sterile field and then disregard of the package. So again, open it from the bottom like this, onto the sterile field and disregard of the package. I can now put my sterile gloves on. And today we're going to be cleaning the dressing with normal saline. So we have our gauze pads in here. In our kit. So you're going to take your dressings and you're going to dip it in the sterile solution that you put in with the wound kit. And you have your sterile gloves on, so you have your sterile tweezers. And you're going to soak one of the 4x4 pads in the normal saline. And then you're going to wring it out with the other tweezer. And then it will be in about a ball shape like this. Always want to go from cleanest to dirtiest when cleaning the wound. Because if you go dirtiest from cleanest, you're going to take the possibly infected part of the wound and spread it to an area that's clean, which can cause infection and make the wound worse in general. And then you're only going to swipe once with the gauze once you've used it, because again, contamination. So you take it and you clean it once and discard of it into the garbage. Then you repeat the same procedure until the wound is clean. So again, dip it in the normal saline until it's saturated. Wring it out, and then put it in a ball formation so that you can clean the dressing, or the wound. And then again, cleanest to dirtiest, only use once, discard, and do it again until your wound is clean. Last one. Okay, so we are going to take the dressing, pack it on, and we have our tape that we secure on each side. And after we have finished the wound, we always want to check with the patient to see if they're comfortable, if there's any more pain, if the pain was better after cleaning it, before we disregard of any of our stuff. So you can ask Mr. Mancini, how does the wound feel? Does it feel any better? Are you comfortable?
Yep, feels okay.
Okay. So once he has said that, we can disregard of all our things. We are okay to take our gloves off from our collect our sterile fields.
Don't you also play the
And throw that out. Every time you do a wound, you have to write the date and time you gave it so that, say the next nurse goes to change the dressing or look at the dressing, they know when it was last changed. So we can write the date and the time. And then you always want to initial it, so you are responsible for that wound dressing in case anything happens. And you always want to go back and document and record everything about the wound, what you observed, what you assessed, how the patient felt. And you always want to let the patient know afterwards that there can be complications or factors that will influence their wound healing. Some things that can influence wound healing is advanced age. It can contribute to diminished proliferation of cells to repair the wound. A patient with diabetes may also have impaired wound healing due to abnormal and prolonged inflammation with diabetes. So you always want to also have a patient health history with you before you do something like this, just so you know you can take these factors into consideration. Things like hypovolemia, hypertension, vasoconstriction, and edema also all negatively affect wound healing because of if you don't have adequate perfusion and oxygenation, then you're not going to have what you need for new vessel development, and that's again going to complicate the wound healing process. So just let your patient know of all the factors, complications that they might experience.